to Healthy Habits channel. Here we give you the latest and surest health facts as it relates to you. Today, we will be looking at 10 possible causes of heavy menstrual bleeding. Heavy menstrual bleeding can cause you to change your tampon or pad every hour or two, or wear a tampon and pad together. And heavy periods aren't just a nuisance. In some cases, they lead to anemia, an abnormal low amount of red blood cells. Anemia can make you weak, dizzy, and short of breath. How much is heavy bleeding? It's difficult to define exactly what a heavy period is because it varies from woman to woman. Heavy for one woman may be normal for another. Most women will lose less than 16 teaspoons of blood, that's 80 milliliters during their period, with average being around 6 to 8 teaspoons. Heavy menstrual bleeding is defined as losing 80 milliliters or more in each period, having periods that last longer than 7 days or both. But it's not usually necessary to measure blood loss. Most women have a good idea of how much bleeding is normal for them during their period and can tell when this changes. A good indication that your periods are heavy is if you're having to change your sanitary products every hour or two. If you're passing blood clots larger than 2.5 centimeters, about the size of a 10p coin. If you're bleeding through your clothes or bedding. If you need to use two types of sanitary products together, for example, tampons and pad. In this new video, we'll be showing you 10 possible causes of heavy menstrual bleeding. Before we continue, make sure you subscribe and click on the notification bell so that you'll be notified whenever we upload a video. 1. Endometriosis. Endometriosis is when endometrial tissue or lining of the uterus grows outside the uterus. It attaches to the other organs and reproductive structures such as the ovaries and the fallopian tubes. Along with heavy bleeding, endometriosis can cause infertility, pain during sex, and pain in the belly or lower back. Endometriosis is common and usually affects women between 25 and 40 years of age. 2. IUDs. Intrauterine devices are small T-shaped devices inserted into the uterus to prevent pregnancy. Some IUDs have hormones and some don't. Non-hormonal IUDs can sometimes cause heavier periods as well as cramps, longer or irregular bleeding, and pain during sex. If you experience any of these with an IUD, talk with your doctor about your birth control options. 3. Uterine fibroids. Uterine fibroids are non-cancerous growths in muscle tissue of the uterus. Uterine fibroids can grow on the inside or the outside of the uterus. In addition to heavy menstrual bleeding, uterine fibroids can cause cramps, lower back pain, difficulty urinating, and constipation. Uterine fibroids are more common for women in their 30s. 4. Uterine polyps. Uterine polyps are ball-shaped growths in the endometrium. Uterine polyps are often benign, but they are sometimes cancerous or precancerous. Other symptoms of uterine polyps are bleeding between periods and irregular periods. Polyps become more common as you approach menopause. 5. Hormone imbalance. An imbalance of hormones can cause the lining of the uterus to grow and be too thick. This can lead to heavy menstrual bleeding. Hormone imbalance that causes heavy bleeding is more common when girls first start getting their periods and as when women approach menopause. 6. Miscarriage or ectopic pregnancy. If you have a notably late period that's also heavy, it could be a sign of a miscarriage or an ectopic pregnancy. Ectopic pregnancy occurs when the fertilized eggs implant outside of the uterus. Both ectopic pregnancy and miscarriage can cause lower abdominal cramps in addition to heavy bleeding. 7. Bleeding disorders. Bleeding disorders prevent blood from clotting. Bleeding disorders that can cause heavy periods include von Willebrand disease, hemophilia, and leukemia. Bleeding disorders can lead to bleeding after an injury, surgery, or childbirth, as well as frequent nosebleeds and excessive bruising. 8. Adenomyosis. Adenomyosis is a condition in which the endometrium, the lining of the uterus, grows into muscle tissue of the uterus. In addition to heavy bleeding, other symptoms may include cramps and pain during sex. Adenomyosis is more common in women in their late childbearing years who have been pregnant in the past. If your family is complete, your doctor may recommend removing your uterus. It isn't necessary to remove your ovaries. 9. Reproductive cancer. Reproductive cancers include cancer of the uterus, cervix, endometrium, and vagina. Fortunately, cancer is a less common cause of heavy bleeding during periods. Other symptoms can include pressure or heaviness in the belly area, belly or back pain, and bloating. 10. Certain medications. Occasionally, certain medications, especially anticoagulants such as warfarin, coumadin, and heparin, that thin the blood can cause heavy menstrual bleeding. Aspirin also can cause heavy bleeding. For pain relief with your menstrual period, choose non-aspirin over-the-counter pain relievers. If you experience heavy periods after beginning a new medication, talk with your doctor. As we conclude, note that heavy menstrual bleeding do not always have an underlying cause, but it can result from problems at various levels, so it's important to get your symptoms checked out. See a GP if you're worried about your bleeding, if your periods have got heavier, if you're also having other symptoms such as period pain or bleeding between your periods. Various treatments are available for heavy periods, including some types of contraception like an intrauterine system or the combined pill, including medicines like tranexamic acid and surgery. And hey guys, don't forget that the information contained in this video is meant to be helpful and educational, but it's not a substitute for medical advice. Thank you for watching. Don't forget to hit the like button and to share with friends. Please subscribe and click on the notification bell if you wish to receive more videos from us. We love you.